The Ministry of Health, in partnership with the Center for Disease Control and Prevention, CDC, has launched a nationwide HIV impact assessment survey and is aimed at understanding the current HIV incidence, prevalence, and viral load suppression among adults and children in Uganda. The survey will generate data that will inform policy formulation and interventions for the control and prevention for HIV/AIDS. The 7-month survey, worth $8 million, is funded by the American Center for Disease Control and is to be implemented by the International Center for AIDS and Treatment at Colombia University. Speaking during the launch of the survey, the Minister for Health, Dr. Ruth Jane Acheng, said at least 30,000 homesteads will be involved in this exercise in a period of 7 months.
The survey will benchmark Uganda's progress towards the targets of 90% coverage in each area. This information is critical in helping Uganda chart a course to reach the targets of UNAIDS that you have all heard and ultimately bring the epidemic under control. It will also build on the previous surveys that were conducted in 1988, 2005, and 2011.
According to the Director General of Health Service, Professor Athon Mbonye, the exercise comes at a time when there are variations in HIV prevalence that is being fueled by different geographical locations and human behavior, which has made HIV become the leading killer disease globally. He cautioned research assistants and data collectors to be mindful of key issues like efficiency, quality, and integrity in order to produce reliable results that will foster and guide the country's way forward in a fight against HIV/AIDS. The American ambassador to Uganda, Deborah Malak, commended the government for its enthusiasm to hold this survey, which he says is a key component in planning and service delivery if government is to meet the 90 targets by the year 2020.
The group's work will provide public health planners, policymakers, and health ministry officials with valuable insight into the HIV epidemic in their respective countries. With this knowledge, officials can provide the necessary resources to populations with the greatest needs, whether revising existing programs or developing new interventions to address emerging problems.
World Health Organization estimates that HIV is still high globally and responsible for the biggest percentage of deaths, and these deaths occur in low-middle income countries, including Uganda.
The overall goal of the Uganda population-based HIV impact assessment, as described already, is to understand the magnitude and dynamics of HIV in Uganda, and also to understand access to HIV prevention, care, and treatment services in order to improve and further target.
About 300 laboratory technologists, laboratory assistants, counselors, and nurses have been trained to undertake this exercise using about 40 land cruisers. The ministry therefore calls upon the general public to cooperate with the survey teams who will be calling into their homes to gather household data. The general public is further assured that there will be a high degree of confidentiality during and after the survey. Harris Tembo, WBS, the Minister of Health, Kampala.